What is the salary you can expect after completion of MD PMR in private hospitals in Tier 1, Tier 2 and Tier 3 cities?
Any graduate between 0 to 2 years of experience will get a salary of 2 to 2.5 lakh rupees per month.
How easy or difficult is it to get a job as an assistant professor after MD PMR in government medical colleges?
So it's still fairly easy. The job market, especially in the government sector and even in the private, but we'll come to that later, it's not saturated at all.
How is the residency in PMR like? I know it's chill, but what are the duty hours and what are you supposed to do as resident?
Your residency will depend on how your institute is and the resources available in your department.
After MD PMR, what are the different options for fellowship which you have?
PMR essentially is an N branch, so we do not have any super specialization in it as of now. There's no DM or an MCH course that you can pursue after PMR, but there are ample postdoctoral fellowships or postdoctoral certificate courses available.
Is it necessary to do SRship after MD PMR? And how easy is to get SRship in AIIMS and other premier institutions?
A lot of people complete at least 1 year of SRship because most of the state colleges demand that. And if you want to apply for a government faculty position henceforth, so you require minimum 3 years of SRship in central hospitals.
If you are planning to start your own center as a PMR specialist, what is the initial investment required that has bare minimum modalities and machines?
For a moderate rehabilitation clinic in a metro or a tier 1 city, a minimum of 75 lakhs to 1 crore investment is required.
What are the pros and cons of taking PMR after NEET PG counselling that every aspirant needs to know about?
You have to struggle for identity. You have to struggle for establishment.
Hello, I'm Dr Rahul Chawla and welcome to NEET PG Mentoring Sessions episode 14. And in this episode, we have Dr Megha Bhargava to discuss with us the future scope of PMR. This branch is pretty old, but it is going to have a great scope in future. And why so? We are going to discuss about that with Dr. Megha. Dr. Megha did MD PMR from AIIMS Jodhpur, and right now she is working as an SR in LHMC. Welcome, Dr. Megha.
Thank you so much, sir. I'm very fortunate to have this opportunity to talk to you about my branch.
So, Dr. Megha, as you know that in this particular series, we discuss about a particular branch, its future scope, how the residency is like, and how the private practice is like, and what the future holds for those who are planning to take this branch. What are the pros and cons, and what advice you would want to give to NEET aspirants who are planning to take this branch. So, starting this with our usual line of conversation, why did you decide to take PMR?
So there can be two answers to this. When I was an intern, I was always very passionate about women and child healthcare. And on the other hand, I was very passionate about orthopedics or sports medicine or PMR because my younger brother is a sports person. He plays badminton internationally and nationally. And that's what got me interested in a field that deals with the musculoskeletal and neurological issues at its core. When I appeared for my PG entrances, which were constantly delayed thanks to the pandemic, ultimately, the final attempt, I got MD PMR at AIIMS Jodhpur, and I couldn't be happier because it was still one of my preferences. Probably not the first, but definitely not something out of what I expected to do. And so I joined PMR, and I'm pretty happy with how I'm doing and how it turned out for me.
So, Dr. Megha, you must have got MD PMR through NICET. So, what were the different branches that you were getting? And after rejecting those branches, you finally took MD PMR. And did you do your own research before taking PMR?
Yes, sir. At the round where I selected MD PMR as the future branch to pursue, the other options that I had were radiation oncology, PMR at other institutes apart from AIIMS Jodhpur, like at AIIMS Bhubaneswar. And then I had the option of transfusion medicine, pathology, and other non-clinical branches. Now, I was quite sure that I wanted to do something clinical, and since PMR was already in my radar, so which is why I selected it. I did research before pursuing PMR because at the institute where I did my MBBS from, PMR was already existent as a department. Even though the full scope of it and the full potential of it was not being realized at my alma mater, but still I had a fair idea of what all this branch entails. And because I was already researching about orthopedic sports medicine and PMR, since I was already exposed to what all the branch is about from during my MBBS days, and I did my fair research wherever PMR is good, like which hospitals provide a very good training program in PMR. And I realized that PMR is a branch which has a fairly good work life balance. It does not have a lot of emergencies, and it has adequate patient interaction because let's face it, there is no dearth of patients in a PMR OPD in any hospital wherever you go to throughout the country. So there's a lot of clinical material. There's a scope and even the time to pursue research in various aspects of PMR, and you can enjoy your life as well.
Yeah, exactly. So, how is the residency in PMR like? I know it's chill, but what are the duty hours and what are you supposed to do as resident? And what were the different modalities that you learned during your residency?
So now PMR being a very vast branch, it has a very varied experience throughout the country. So there are some hospitals like AIIMS PMR or AIIMS Delhi, SMS Jaipur, which have been running the course for many decades now. And SMS Jaipur even has a spinal injury center, the state spinal injury center, which is basically run by PMR physicians. So they are involved in acute care also. So if you talk to a resident from SMS Jaipur, they will have a fairly tough life. They will have extensive work hours. They will have night duties and a lot of emergencies to cater to. I did my residency at AIIMS Jodhpur, where it was not that hectic. It was well balanced. We had in the first year, of course, it's hectic because you have the ward work to cater to. You have to see inpatient referrals, and then you have your OPD duties. So apart from 9 to 5, maybe an hour or two here and there for doing all the extra work. So you are mostly free by 6 or 7 p.m. in the evening. In the second and the third year, the timings mostly are 9 to 5, and you are involved with a lot of hands-on work. So apart from your academics, everything that happens in the department, all the postgraduates are involved in that, as well as the senior residents. And if you go to centers like AII PMR Mumbai or SV Nirtar in Cuttack, Odisha, now these are surgical centers. So they do rehabilitation surgeries for conditions like post polio, paralysis, cerebral palsy, or other deformities which are a sequelae of conditions like, say, myelomeningocele. Now, because there are surgeries involved, a lot of pre-op and post-op care goes into those patients. So even those residents will have a lot of work hours, which are more extensive than centers in central institutes. PMR mostly is available in all the central institutes. So most of your peripheral AIIMS and AIIMS Delhi, of course, will have it. NIMHANS has it. PGI Chandigarh, as of now, does not. They have a department, but they do not have an MD training program as of now. JIPMER has PMR. And apart from that, a lot of state medical colleges also have PMR. So you can get through the branch via both the routes, the NEET PG route and even the INI PhD route. Your residency will depend on how your institute is and the resources available in your department.
Apart from AIIMS and peripheral AIIMS, which are the topmost institutes for PMR that students can opt for? And also, is there any PMR department in the private hospitals as well? Are they offering any DNB course in PMR also?
That's a good question, sir. So apart from peripheral AIIMS, NIMHANS, and JIPMER, SMS Jaipur, that's the Mansingh Medical College Jaipur, has a Rehabilitation Research Center, RRC. They have been running the course, the MD course in PMR for decades now. AII PMR, that is All India Institute of Physical Medicine and Rehabilitation in Mumbai, was one of the first medical colleges or autonomous institutes to start the program. CMC Christian Medical College Vellore runs a very good PMR program. Apart from these, hospitals like Kokilaben Dhirubhai Ambani Hospital runs a DNB course in PMR as well. And then there are other centers like SV Nirtar. A lot of colleges in Bengal have MD in PMR. NILD Kolkata has a DNB PMR. And I'm sure I'm missing out on a lot of colleges here, but you get the gist. So there are ample seats if anyone wants to pursue the course, and they can go via either of the routes. So you can get into central institutes as well, and you can get into state or autonomous institutes as well.
You talked about few of the procedures that you get to do in PMR during residency. Can you enlist what are those procedures? And also, do you get to do those procedures independently by yourself once you become a consultant in private practice?
So pain management, whether medical or interventional, is an integral part of physiatry or physical medicine and rehabilitation. Pain procedures and procedures related to spasticity management are included in the competency-based curriculum given by NBE. So, as a JR or as a postgraduate, you are supposed to be trained in procedures which can be CM based or ultrasound based, like intraarticular injections, peripheral nerve blocks, caudal epidural steroid injections, then sympathetic ganglia block, or even chemodenervation. Then for spasticity, phenol injections or botulinum toxin injections, and even motor point blocks. All of these procedures are supposed to be taught to you, and you're supposed to be trained in them while pursuing your post graduation according to NBE. And most of the centers which run a PMR course offer these services to their residents. Now, depending on whether your center is a high volume center or a low volume center, the number of procedures you might get to do will vary. But more or less, every physiatrist who has graduated will be having some idea of how to do these procedures independently. Because, like in our institute, now AIIMS Jodhpur runs a fellowship in pain and palliative care also. Earlier, it was jointly run with the Department of Anesthesiology, and now it has been bifurcated. So both of these departments run their separate fellowships now. So because of that, the junior residents at AIIMS Jodhpur get a lot of exposure pertaining to pain and cancer rehabilitation. So because a lot of like pain management is one of the major crux of cancer rehabilitation as well. And centers like Kokilaben Dhirubhai Ambani Hospital also have a very good pain interventional clinic. So, and apart from these, even electrodiagnostics, so nerve conduction studies and electromyography. This is also one of the skills in which PMR residents are trained in. Apart from this, they're also trained in casting. So, because we get a lot of patients who have deformities, patients of post-polio residual paralysis, of cerebral palsy, of meningomyelocele sequelae, CTEV. Such patients require regular and serial castings, which have been taught to us and are being practiced by physiatrists all over the country. Even diabetes related foot disease. So, suppose a patient is referred to your diabetic foot clinic by endocrinology or medicine, and the patient either has an active Charcos or probably has an ulcer. Now, the complete management of that is also done by physiatrists. So, whether the patient requires a total contact cast, that is a TCC, or the patient requires an orthotic walker, that is going to be decided by a PMR physician and ultimately supplied by the rehabilitation team. So all of these things, it's a pretty hands-on branch. It's not just medical. It's not surgical entirely. It's a balanced mix of everything. And in a way, you're getting to practice non-pharmacological, pharmacological, interventional, and even surgical methods of management. So it's not just about the treatment per se. It's about a holistic and comprehensive management of a patient. And this is something that I totally believe in, that if you encounter a good physiatrist, it's very hard to beat their assessment.
After MD PMR, what are the different options for fellowship which you have?
So PMR essentially is an N branch. So we do not have any super specialization in it as of now. There's no DM or an MCH course that you can pursue after PMR. But there are ample postdoctoral fellowships or postdoctoral certificate courses available. So my alma mater, AIIMS Jodhpur, runs a 1-year PDF fellowship in pain and palliative care. Then institutes like NIMHANS Bangalore and CMC Vellore run fellowships in neuro rehabilitation. Then hospitals like Amrita Hospital, Kochi also runs a fellowship in pain management and pelvic pain management, which is a very unique aspect actually and often overlooked. Then Sri Aurobindo Hospital in Indore runs a fellowship course for palliative care or oncological rehabilitation. Then you can have a lateral entry towards post-medicine fellowships also. It used to be available at KGMU Lucknow previously, but it's a little dicey as of now. However, you can get into the department if you do want to pursue that. Then there are postdoctoral certificate courses available in Kolkata. IGPMER runs in, again, pain management, and AIIPMR runs a fellowship in surgical rehabilitation.
And most of these fellowships are recognized by MCI or NMC?
Yes, sir. They are recognized.
Are there any fellowships or short courses that you can pursue abroad And how are the opportunities in PMR abroad in UK and other countries?
So, unlike India, PMR or physiatry or rehabilitation medicine as a branch is very well established in countries like the US, UK, and Australia. So, we have a lot of people who go to the NHS every year to pursue fellowships or even look at it as a permanent settlement option in the UK. There are probably 25 to 30 fellowships available all across the world, which are open to PMR graduates from India as well. The pathways might differ. For example, in US, you can only pursue a fellowship only after you are ECFMG certified. So you will have to go the USMLE route. However, when it comes to UK and Australia, a simple licensing might be enough. So once you clear the AMC, that is Australia Medical Council exam, you can pursue fellowships or further studies in Australia. In the UK, you can go the PLAB route, you can go the MRCP route, or you might be GMC registered, depending on your credentials also. So, in that case, you might not need to take an exam, and then you can go on to pursue those fellowships. Now, these fellowships are in various aspects of rehabilitation, which are not just restricted to pain. They definitely include interventional pain management, but it's not just that. You have cancer rehabilitation, geriatric rehabilitation, pediatric rehabilitation. Then in neuro rehab, you have three different subsets. So SCI rehabilitation will differ from that of stroke and that of TBI. And then you have things like even chemodenervation or cryoneurolysis. So these have their own courses. So it's up to you if you want to go. The field is open, and PMR in US is a super specialization. So once you have done your IM residency, is when you can go for PMR. However, it's a specialization right after your undergraduate in countries like the UK and Australia.
How is the scope of PMR in Dubai and other Middle East countries?
So the Middle Eastern countries are coming up with the various opportunities for PMR graduates, and we have a few people working there. And the pay is very handsome. And also, Middle East actually provides a lot of subsidies to medical graduates in terms of taxes and their children's education or their own healthcare. So it's roughly 7 to 8 lakh rupees per month in Indian rupees, the starting salary, which is higher definitely compared to the Indian market, and at the top of that you get all of these perks. So they are coming up with a lot of opportunities, and uh, a lot of people from Kerala and even from other South Indian states do tend to explore that option as well. A fellowship might be preferred in that case, but definitely not mandatory, because they also understand that such things are a part of your curriculum even as a junior resident. So you have been trained in those aspects as a part of your PG degree as well. But definitely, if you have a fellowship or degree certifying that you have, mastered the art of that aspect of rehabilitation, it does get you a better package.
Is it necessary to do SRship after MD PMR? And how easy is to get SRship in AIIMS and other premier institutions?
So, like any other branch, it's not mandatory or necessary to pursue your senior residency after completion of your post graduation. However, most of the postgraduates take that route. So now there is no dearth of jobs after PMR, especially in government sector. Almost every medical college that has a department will have ample SR seats for you once you finish your MD. So you can either apply to your state college, you can apply to central institutes, or you can apply to corporate or private medical college as well. And usually, I don't think there's a lot of wait time or lag time for people after their MD completion. They almost get a job within a few months. And while coming to it, whether it's really necessary, it's not. It depends on your acumen. You might have some ideas regarding what you want to do after your post graduation. So, if you are actually inclined towards that, a lot of people do tend to go into private practice immediately. Or some of them might like to have a safety net and may want to get some more exposure, because you have a lot more autonomy and independence as a senior resident than you have as a postgraduate. So a lot of people complete at least 1 year of SRship, because most of the state colleges demand that. But however, it's for 3 years if you are in Delhi or any other central institute, and if you want to apply for a government faculty position henceforth, so you require minimum 3 years of SRship in central hospitals.
How easy or difficult is it to get a job as an assistant professor after MD PMR in government medical colleges?
So, sir, as of now, applicant to job ratio is fairly balanced because as more departments are being opened up, there are more posts being created. So most of the peripheral AIIMS have a department as of now, and almost all of my senior residents are placed in one or more peripheral AIIMS, and they are running a single man show as of now. So even though they are assistant professors, they are doing a brilliant job in setting up and establishing departments in hospitals like AIIMS Bhatinda or AIIMS Bilaspur. And now this is a golden chance because that department technically will be known by your name. You are the one setting it up. This is happening even in state medical colleges where new departments are coming up. So it's still fairly easy. The job market, especially in the government sector and even in the private, but we'll come to that later, it's not saturated at all. So a job is fairly guaranteed. Now, you might have your own preferences, like you might want to take a job in your hometown or at least near to your home. That might decrease your chances a little because you are narrowing your circle. But otherwise, if you're open to traveling or trying out newer places or having varied experiences, then you will get a job very easily. I don't think it's difficult at all.
What is the salary you can expect after completion of MD PMR in private hospitals in Tier 1, Tier 2, and Tier 3 cities?
Sir, a lot of private medical colleges as well as private hospitals in metros are realizing the worth of physiatry or PMR and are establishing and engaging PMR physicians in their already existing or newly upcoming rehabilitation programs. So a salary of 2 to 2.25 to even 2.5 lakhs is what is the market rate currently for people who have either completed their MD PMR or have at least 1 or 2 years of experience, say as an SR post their MD. A lot of them target neurorehabilitation. So PDF in neurorehabilitation is preferred but not essential. So any graduate between 0 to 2 years of experience will get a salary of 2 to 2.5 lakh rupees per month easily. Now, in Tier 2 or Tier 3 cities, PMR as a branch is not that visible or even existent, if I may take the liberty to say that. But a lot of people who belong to smaller towns or smaller cities have been opening their private setup of late and are doing really well in cities like Jaipur, which is a Tier 2 city, almost a metro now. It's almost Delhi. So in Jaipur, there are a lot of PMR physicians who are working as consultants in private or corporate setups and run their own clinic also side by side. So they are practicing medical and interventional rehabilitation there and doing very well for themselves. In Tier 3 cities, I do not think that there is a lot of setups as of now. But definitely, if more people do try and open up, it's an open field. My teacher used to say कि PMR एक बहुत ही खुला खेत है, तो जैसा आप जोतोगे वैसा ही आप फल पाओगे. So as you sow, so shall you reap is what goes for the branch.
Why is it that most private hospitals in Delhi and other metros do not have PMR department and they don't even hire a PMR specialist to run their OPDs?
So PMR is a very well-established branch down south. Cities like Bangalore and Hyderabad are also coming up with setups in private medical colleges and private hospitals. However, North India lags behind. In Delhi, apart from Amrita Faridabad and Indian Spinal Injury Center, Vasankunj, as of now, I don't think there's a PMR department per se. Most of the rehabilitation protocols are being run by therapists, physiotherapists, or occupational therapists. I don't think that they actually realize that rehabilitation medicine is a whole different science. It's not just exercises or it's not just modalities, it's not just therapy. The fact that you need to have a whole rehabilitation team which is in constant to and fro conversation with the treating physician. If I may give you an example, suppose a stroke case comes to the emergency. Now, you as a neurologist would be called to take care of the acute stabilization phase of the patient. Now, ideally, a physiatric assessment needs to be done by day 3 of admission. So even while the patient is in ICU, a physiatrist or a PMR physician needs to come and see the patient, do the assessment, and even give a preliminary functional prognosis of how much the patient can improve. And within day 7, an active acute rehabilitation program needs to be started. But now these are just guidelines. How many of us do actually practice that? Because there is not awareness. That is the main thing. PMR as a branch is not very well visible. It's not marketed, it's not advertised enough. So even medicos and laymen both do not really understand that how much of a difference an active and a timely physiatric assessment and management can play in a patient's life. Time is function, and that is something that not a lot of people realize. Because for them, that okay, this is the disease, we have treated it, and now the patient and their family is left on its own. Like, what now? Suppose caudal equina comes to you, a neurosurgeon operates it, but what after that? Will the patient walk? Will he regain control of his bowel and bladder? Will he able to integrate himself into the community? A neurosurgeon will not have answers to that. A rehabilitation medicine physician will. But people need to realize that in order to establish a setup where they have space for rehabilitation medicine to come to fruition and even grow as a specialty.
What happens in private hospitals is that usually they have departments wherein the patients get admitted, or they have departments wherein there are one or two consultants. Most of them are visiting faculty, maybe psychiatry or dermatology, and maybe they don't just see OPD patients, but they also see referral cases. So this is how hospital operates. In PMR, usually there are no admissions. Okay, they might only see OPDs. Most of the OPDs seen by PMR specialists are usually patients of ortho, neuro, maybe some amount of general surgery. And these patients are obviously taken up by those respective branches. They won't be referring those patients to a PMR specialist. The other thing is, most hospitals, they have their own physiotherapy units. So the rehabilitation part is taken care of by physiotherapists. So if a patient is seen by a neurologist, then a physiotherapist will do an assessment and they will guide the therapy. But that rehabilitation part is definitely messed up. And if there is a PMR specialist who can do that job and who can guide physiotherapists to do that, the needful, I think the patient can be better managed. But things don't work like that in private hospitals. And in fact, even in government setups, I have been to Safdarjung and also AIIMS, the PMR department doesn't take that much of an active role in managing such patients. They have their own department. Any patient who is referred to them, they would see it. Otherwise, they won't play any role in active management of such neurology patients or any such orthopedic patients. So perhaps that is why the doctors are not aware that, what is the role of PMR specialists in their management of their patients. And also private hospitals, because they already have ortho surgery and neurology, and they also have physiotherapists, maybe they are not able to figure out what exactly is the role of PMR specialists and where do they place them.
Sir, I would like to differ from you here to a certain point because so you have been at AIIMS Delhi and you have been at Safdarjung. You know that they have their inpatients. The kind of role that the departments play in the management or the care of such patients is always varied and probably even debatable because every department runs in its own way. But the thing is that we do have inpatients, and in most medical colleges, upwards of 10 to 60 beds will be available for PMR. Even a 30-bedded rehabilitation center is what is approved by the government of India. Now, the patients that we admit are mostly cases of chronic neuromusculoskeletal diseases. So we will have spinal cord injury, we will have stroke, we will have traumatic brain injury or head injury, we will have cerebral palsy. We might even admit patients who require procedures such as sympathetic ganglion block or even procedures for spasticity management. Now, we might admit patients of diabetes-related foot disease also. We might admit patients for pre-op and post-op management. Say someone who underwent total knee arthroplasty. So you might admit that patient for post-op pain management or post-op rehabilitation also. Now, what is important to understand here is that rehabilitation is not just physiotherapy, and which is what a lot of private and corporate hospitals tend to believe. So you cannot have 4 or 5 specialists referring patients to just physiotherapy or occupational therapy, and then thinking that they will regain all the function that they're supposed to regain, or they will reintegrate them back into the community. Because rehabilitation is multidisciplinary in its essence. At the core or at the topmost level of hierarchy of rehabilitation, you have a rehabilitation medicine specialist or a physiatrist or a PMR physician. Now, these will integrate and even coordinate with the treating physician. So, for example, since we were taking an example of stroke, so suppose a patient is admitted in a neuro ICU and you call a physiatrist on day 3 of admission. So, the physiatrist will coordinate with the neurologist here, and then they will chart out a rehabilitation protocol which will be executed by the therapist, and the medical part will be taken care of both the neurologist and the rehabilitation medicine specialist. Now, because rehabilitation medicine specialists are specifically trained in all of these aspects also, physical therapy, occupational therapy, speech language pathology, prosthetics and orthotics, and even the medical legal aspects pertaining to social work or disability. So all of these things are being undertaken and taken care of by one specialist who is coordinating with all of these aspects. It's a to and fro conversation. Every member in a rehabilitation team has their own contribution and their own role to play. So you can't say that PT is not important or OT is not important. Of course, they're important. But rehabilitation is not just about that. And that is where most people miss out because they don't understand the essence. And it goes for both medicos and laymen. I have been answering this question, what is PMR, ever since I took the branch, to both my relatives or even my undergraduate batchmates. And even though we had the luxury of being in a department which was a high volume center, we still were mostly justifying why we took the branch or what we do exactly. So I think a lot of conversations need to happen about the branch because 80 years since its inception, and we are still confused as to what we do.
I totally agree to your point. But what I am trying to point out here is that the integration you are talking about is not happening in reality. So a neurologist, orthopedician, and surgeon, they are seeing their patients independently. Then the patient goes to a physiotherapist. There is no occupational therapy. There is no particular rehabilitation that is happening. And if any particular modality is required, some of those modalities might be performed by a physiotherapist or by an orthopedician or by a specific pain physician. Okay, so that integration part is really missing. And it's not just the private sector, but in fact, in the government sector also, PMR separately functions as a department. It is fine. But that integration you are talking about, it doesn't happen much in reality. Is there any example we can look forward to where this integration is happening or where the PMR department is functioning in totality? They have their own setup and modality, and they have physiotherapists working under them.
So the setup is like that in most of the medical colleges and even in private setups. So hospitals like AIIMS or Safdarjung or Lady Hardinge or even other peripheral AIIMS, the structure is that you have a head of the department, you have other faculty members, you have senior residents, junior residents, and then you have other rehabilitation team members, as I mentioned previously. So there will be PT, OT, SLP, a social worker, a prosthetist, and an orthotist, even a dietitian and clinical psychologist in some cases. Now, even in private medical colleges and corporate hospitals, a very notable one would be Kuklavend Dhirubhai Ambani Hospital in Mumbai, where Dr. Abhishek Srivastava is the director of rehabilitation there. So patients come to his name, he sees independent patients. So there the patient is not labeled that acha ye ortho mein jayega ya ye neuro mein jayega. So they have a set of conditions where PMR is supposed to be involved, and PMR is involved there primarily, not even as a referral. And in most government medical colleges as well, because we have our own patients in OPDs. So it's not that, okay, low back pain सिर्फ ortho या neuro के पास जा रहा है, low back pain PMR के पास भी जा रहा है. What we see, वो हमारे पास आता है. And ये almost हर जगह ऐसे ही हो रहा है. Now, physiotherapy department occurs separately also in some colleges like RML, and even Safdarjung has a separate physiotherapy department per se because they run bachelor's and master's courses in physiotherapy. ऐसा नहीं है that physiotherapy is supposed to be just under PMR. It can definitely exist as a separate department for people who want to say just refer to physiotherapy. Uh, that is because they might have certain needs for their own patients, and that's perfectly fine. Uh, but the thing is that a patient might not just require physiotherapy, their needs might be different. So, for example, if a spinal cord injury comes to us only for limb and chest PT, उससे उस पेशेंट का कुछ नहीं हो रहा है. So there have to be a comprehensive rehabilitation, and that can only be decided by a physiatrist because they are trained in all these aspects: medical, that is pharmacological, non-pharmacological, interventional, and even surgical if required, pertaining to the center. So only referring to a subset of the branch as a whole is not going to solve any purpose or is not really going to help the patient functionally, because PMR looks at function as its essence. We are actually working on functional improvement and quality of life. The what now that other specialists tend to ignore is what we are looking at. And which is why it's important for people to understand that rehabilitation is not just exercises, and it's a lot more to that. And like just one answer or one podcast is never enough to actually because even for us, when we got into the branch, we had a very different notion to what it is than after completing your post graduation and some months into senior residency. The outlook and the perspective that you have towards the branch, the vision that you have towards the branch is a lot more different. So if it can take PMR residents also that much of time to understand what the branch is all about, definitely it's going to take a lot more time for other people to accept PMR as a full-fledged medical specialty and not an afterthought or not an adjunct specialty that you require to supplement your treatment, right? Because we have our own management, and that is what is needed. Now, I understand no one is going to give you their patient willingly. So, which is why we need to understand which patients need to be seen by PMR primarily and not just orthopedicians, neurologists, or neurosurgeons. So, that is where awareness is required.
I think even the doctors are not aware about the branch at the moment. And if I talk about patients, perhaps the awareness is even less. If suppose a person has a headache, the patient would just type on Google headache doctor in Delhi. In fact, the patient would know for headache, he needs to consult a neurologist. So the patient would just type on Google best neurologist in Delhi. The patient would get certain leads and the patient would go to the doctor. But why would and how would a patient would turn up to a physiatrist's clinic? And when the patient doesn't have that awareness that he might need to go to a PMR specialist or a rehabilitation specialist, so how the patient is actually going to turn up to a physiatrist if the person starts its own setup? That is again a big question. Taking that forward, I would want to talk about the scope in private practice and private clinical setup. So how easy is for a person to start his or her own setup in PMR in metros and in tier 2 and tier 3 cities?
So the scope is immense because there is an abundance of conditions that you see. There's an abundance of patients that you see. So say from something as simple as a post-viral arthralgia to a full-blown rheumatoid arthritis, coming to you with deformities of the hand and joints, from a head injury to cerebral palsy, from spinal cord injury to stroke, from a osteoarthritis in the nascent early stage to a post-arthroplasty osteoarthritis patient. So you can see a whole spectrum of patients, and at every given stage, uh, how they will present to you will also differ with their stage. And most of your patients that you see will be your patients right now. Because, see, now spinal cord injury, even if you do as perfect a rehabilitation as you can, the patient is not going to get nearly normal because that's the nature, that's the course of the disease. So they will keep coming to you with different complications at different point in time. Same with conditions like cerebral palsy. The chronicity of such conditions is where you're involved. That's your bread and butter. So once a patient has been attached to you, they will remain your patients lifelong. So there is no dearth, and I think it ultimately depends on your intent. So even in tier 2 and tier 3 cities where people are not really aware of what even the different super specializations or specializations are. They just want to go see a doctor because the doctor is not available for kilometers at end. So उनको नहीं फर्क पड़ रहा है कि आप न्यूरोलॉजिस्ट हैं या पीएमआर है, उनको डॉक्टर चाहिए. तो वो आपके पास अपने कमर दर्द से लेके घुटने के दर्द से लेके लकवे तक भी आ सकते हैं. And ultimately, because you have the skills to manage that patient, you will be able to do a good job. So to earn, you don't need a degree. To earn, you need a presence of mind and skills. Ultimately, it's all about your skills after a certain point in time. So setting up a practice in metros versus tier 2 or versus tier 3 cities will be very different, because in metros, people are a lot more aware about bifurcations of domains, the specializations as well as super specialization. So they know कि अच्छा अगर उनको headache हो रहा है, वो migraine हो सकता है, उसके लिए उनको neurologist को देखना है. So they will directly search for a neurologist. They won't even go to a general medicine person. And same goes for other branches as well. So that is a point where PMR usually suffers, because, as you said, visibility is not there. So even when I Google a PMR physician in Delhi, I might be directed to a medical college department and not to a private practitioner. Now, this has a very operational challenge actually, because the number of seats for PMR are less. That is the main thing. That where a college might have over 100 seats for anesthesiology and critical care as a branch, for PMR it might only be 2 or 3 per session in one college. And so we don't have a lot of graduates, we don't have a lot of residents, and therefore we don't have a lot of visibility. But the residents and doctors that we have are doing wonderfully in their domains. It's a matter of time. When seats are increased, we have more people coming in, and we have more people diverging into private practice and corporate setups. Now, it's not even like that people don't listen. Sometimes when you actually go and explain the importance of the branch, a corporate hospital might actually be interested in opening uh, a setup, an establishment for rehabilitation, because it does generate revenue. As I mentioned, these people will keep coming to you again and again. So they will generate revenue in terms of outpatient clinics, in terms of inpatient stay, in terms of modalities, procedures, and even therapy sessions for that matter. So it's highly revenue generating. It's only a matter of time, I guess.
So definitely there are initial hurdles when you start your own practice or you try to join a corporate hospital. But what I believe is that this is an enchanted territory and there is a lot of scope and there is no saturation as such. And if somehow you're able to cross that hurdle, you're able to have your presence felt, whether it's through marketing or through word of mouth, through the patients that you are treating, definitely in that particular locality or area, you will get renowned very soon, because there are so many patients who have back pain, who have arthralgia, myalgia, cervical spondylosis. There are plenty of such patients. And these patients are hopping around from orthopedician to neurologist to neurosurgeon, then psychiatrists, then physiotherapists. There's so many things. There are so many people who are actually engaging with such people. And if you are able to treat them in a better way through the modality, not just through medications alone, then I think those patients are definitely going to come back to you and it's going to give you a good word of mouth. I'm not sure about tier 1 city, but definitely tier 2 and tier 3 cities, you can definitely make an impact if you start your own setup. It's a clinical branch. You can have your OPD. The OPD numbers can be humongous. You don't need to admit the patient. There is no emergency per se. And only through OPDs and modalities, you can earn very good. And then you can decide to start your own rehabilitation center, get in modalities and different machines, and then even hire physiotherapists thereafter. If you are planning to start your own center as a PMR specialist, what is the initial investment required that has bare minimum modalities and machines?
Right. So the answer to it will vary. But if you are going to consider opening your own rehabilitation center with, say, moderate amount of modalities, probably an ultrasound machine, and a setup for OPD, as well as say daycare, if you're doing procedures, it will require a minimum of 75 to 1 crore, or 75 lakhs to 1 crore of investment. Now, this is only if you're going at a moderate level. You don't have a lot of high-end machines. You're not taking the state-of-the-art ultrasonography machine. Of course, depends on your spending capacity, depends on whether you have land or not, depends on whether you already have an existing setup or not. In tier 2 and tier 3 cities, the cost might come down because the logistics cost decreases there. So you can buy better equipment, which is not the case in metros or tier 1 cities. And now, the thing is that you can even run a simple OPD as a PMR physician. So that will not require a lot of investment because you are running a simple OPD. And even in that way, you can earn a lot. I know of a lot of people who have done that as well. And they're earning a minimum of 3 to 5 lakh rupees per month in cities like Chitrakoot, Uttar Pradesh. So, totally depends on how you want to take it forward and what field of rehabilitation you want to practice. Suppose if you're trained surgically in rehabilitation and you might want to have an OT setup as well, the cost will go up because you require a modular OT, you will require OT technicians, you will require a support staff, you will require nurses, um, and you will require a lot of clearance from the government and biomedical waste and all of these things as well. So it totally depends on what sort of a setup you're looking for. But for a moderate rehabilitation clinic in a metro or a tier 1 city, a minimum of 75 lakhs to 1 crore investment is required.
To summarize, what are the pros and cons of taking PMR after NEET PG counseling that every aspirant needs to know about?
So I would say that if you're looking for a clinical branch foremost that has mainly medical management in its core, but also offers you interventional and surgical tastes. And then if you're looking for a good work-life balance, if you want to at least get 6 to 8 hours of sleep per night, if you want to get home on time, if you want to enjoy a variety of OPD cases, not just pertaining to one niche, but a variety. And if you are keen on reading also, then PMR is the way to go because it is a very vast branch. You need to have a knowledge of almost everything. It's akin to probably internal medicine or even pathology when it comes to the amount of reading that you might have to do, because the patient will come to you from any specialty or with any complaint, and you will have to cater to that. So if you have the appetite for knowledge and reading even after your MBBS, but something that will still get you a good sleep, PMR is the way to go. But on the other side, the thing is that seats are less. So definitely it's competitive if you are choosing it yourself, but it's not that competitive. So even middle rankers can get a good college at if they want to choose PMR. Uh, Same for INI also. So if you have an average rank in INI CET, you might be able to get your MD in PMR at any of the central institutes, the peripheral AIIMS or NEMHANS. Now, the cons, one of the major cons is the lack of awareness, basically. If I can be candid and take the liberty to say it, a lot of people do consider you as a glorified physiotherapist. Now it's up to you how you want to take it. You can completely ignore it, or you can even make that your sword and actually show what more you can do. So it totally depends on you. One of the very major cons again is the time to settle. So basically, you will get a job easily if you want to settle in a government setup. However, to create a name and actually to establish yourself and propagate your branch further, there is struggle. I'm not going to sugarcoat it. You have to struggle for identity. You have to struggle for establishment. And you might have to struggle to even explain or ask for referrals from your fellow colleagues. So that is one of the major deterrents, because a lot of people, after going through the grilling phase of undergraduate medicine, might not want to take a branch which is not very well established or not very well known amongst its peers or even their families or their relatives. So we usually don't want to get into something that is not known and might require even more work. We want something that will be easy. We want something that has a very clear-cut pathway. So general medicine चाहिए, इसके बाद NEET SS देना है, INI SS देना है और अपनी super specialization लेना है. But after MD PMR, what next? because there's no super specialization. But you can still foray into so many things. So it's up to you how you want to take it, whether it's a con or a pro. If you have the zeal or the enthusiasm to actually create a name for yourself, you can very well climb up the ladder in a short span of time if you have taken PMR.
Very well stated, Dr. Megha. And I think to summarize, it's a very emerging branch. Although the branch is very old, but its scope is still not yet defined and not yet known to many in our own community and obviously patients as well. The awareness is not so much, but still it's an end branch, no super specialty, lots of fellowship options, and lots of scope in private practice, especially if you do a fellowship in pain. And also, you can even venture out in tier 2 and tier 3 cities, start your own setup. And if you are able to connect with your patients, there is some word of mouth, and you do some marketing, maybe digital marketing or on ground marketing, and you are able to cross that initial hurdle, then I think it is your go to branch. It is going to give you a great satisfaction. There is no emergency. Work life balance is good, and even in residency it has great work life balance, no toxicity. So overall a good clinical branch. If you are not getting your medicine, surgery, or orthopedics, this is the branch you can obviously consider. And I really hope that in coming years people might start to take this branch earlier, and they won't just wait that they are not getting any other clinical branch, so then they would opt for PMR. Perhaps by choice, I believe that people will start taking PMR earlier during counseling. Thank you so much, Dr. Megha, for your time. It was a very interesting session, and we were able to clear a lot of misconception about PMR. And I really hope that students would take some cue out of it. And who knows, someone might even think about taking this branch. Thank you so much for your time.
Thank you so much, sir. It was a pleasure talking to you. And I would be thankful if someone actually resonates with my vision and the satisfaction that this branch has provided me over the last 3.5 years. And I do hope that it is integrated into and considered a mainstream medical specialty and not just something that you take up when you don't have any other option. And the scope definitely is immense, and and as well as a lot of my colleagues that I know of have been absolutely satisfied with their choice. I don't think there are any regrets, and I do believe that even upcoming doctors will feel the same once they actually get into it.
Exactly. Thank you so much, Dr. Megha.